Transmission cycle of Dracunculiasis, Guinea Worm Disease. Dracunculiasis, commonly known as Guinea Worm Disease, is a parasitic infection caused by the nematode worm Dracunculus medinensis. The disease has plagued humanity for centuries, but extensive efforts have been made to control and eventually eradicate it. Understanding the transmission cycle of Dracunculiasis is crucial in devising effective prevention and control strategies. Transmission cycle. Infection in humans. The transmission cycle begins when humans ingest water contaminated with copepods, small crustaceans that are the intermediate hosts for guinea worm larvae. These copepods carry the infective larvae of D. medinensis. Larval development. Once inside the human body, the larvae mature over a year into fully grown female worms, which can reach lengths of up to 3 feet, about 1 meter. The worms primarily reside in the subcutaneous tissues, often in lower extremities, causing painful blister-like lesions. Blister formation. As the female guinea worm reaches maturity, it causes a painful blister to form on the skin. The blister usually occurs on the lower limbs, especially the feet and legs. The presence of the blister prompts the infected individual to immerse the affected limb in water, seeking relief from the intense pain. Emergence and release. When the blister comes into contact with water, the female worm releases thousands of immature larvae called microfilariae into the water. These larvae are too small to be seen with the naked eye. Ingestion by copepods. The released microfilariae are ingested by copepods, which are aquatic organisms present in many sources of water. The larvae penetrate the copepod's digestive tract and become encapsulated in a protective cocoon-like structure. Consumption of contaminated water. Humans continue to ingest contaminated water containing copepods with encapsulated larvae. The life cycle is perpetuated as the ingested copepods are digested, and the larvae are released into the stomach and intestines. Larvae release and penetration. The larvae are released from the encapsulated structures and penetrate the walls of the stomach and intestines. From there, they migrate through the body, reaching the connective tissues beneath the skin. Subcutaneous migration. The larvae continue their journey within the host's body, migrating through the connective tissues. This migration causes the formation of painful blisters and ulcers, perpetuating the cycle. Control and eradication efforts. Guinea worm disease has been targeted for eradication by various global health organizations. The Carter Center, World Health Organization, WHO, and other partners have played instrumental roles in controlling and eliminating the disease. The eradication strategy primarily involves health education, provision of safe drinking water, and containment of affected individuals. Health education. Communities at risk are educated about the transmission cycle of guinea worm and the importance of preventing contact between emerging worms and water sources. Health workers and volunteers raise awareness to discourage infected individuals from immersing their limbs in water sources, thus preventing further contamination. Provision of safe drinking water. One of the key strategies for guinea worm eradication is providing communities with access to clean and safe drinking water sources. By ensuring that people have access to uncontaminated water, the risk of ingesting copepods and perpetuating the cycle is significantly reduced. Case containment. Infected individuals are provided with proper wound care to prevent secondary bacterial infections. The use of a small stick to carefully extract the worm from the blister is a crucial step in the containment process. This minimizes the risk of worm breakage, which could lead to secondary infections and further contamination of water sources. Surveillance and reporting. Active surveillance is crucial for identifying and containing new cases promptly. Health workers, volunteers, and communities collaborate to report cases, allowing for quick response and preventing the spread of the disease. Global progress. Through concerted efforts, the number of guinea worm cases has significantly decreased over the years. As of insert most recent data, there were only a few reported cases globally, indicating substantial progress towards eradication. Conclusion. Understanding the transmission cycle of Dracunculiasis is essential for effective control and eradication efforts. By targeting the various stages of the cycle, health organizations have made significant strides in reducing the prevalence of Guinea worm disease. Continued education, provision of clean water, and vigilant surveillance are key components in achieving the ultimate goal of eradicating this ancient and painful parasitic infection.